I never dreamed that this would have happened. I'm also a talker while I'm a walker, Dr. Horn, but you're blessed because I had a hip surgery about 30 days ago, so I won't do so much walking. But this is really fabulous. This is a dream come true for me, where mental health and addiction are center stage, not just in our medical home where we need to be, but also in Christian circles. So thank you for putting this on and for suggesting this topic here. A couple things about the actionable points from today. This is my Narcan kit. So who here carries around a Narcan kit? So potentially that could be one actionable thing if we're here next year and every hand goes up, right? That would be a really, I think, a great response to our talk today. Who here has an ex-DEA waiver to prescribe Suboxone? Anybody here have a waiver to prescribe Suboxone or training for that? So Suboxone is a treatment for opioid use disorder, right? And office-based treatment for opioid use disorder. And if we're waiting for the addiction psychiatrist to have enough addiction psychiatrists to treat the opioid epidemic, we're never going to get anywhere, right? So we have one person with an ex-DEA.
If you prescribe for pain, you don't need a waiver.
Right. If you prescribe it for pain, you don't need a waiver, right? But I think if all the NPs, physicians, PAs raise their hand next year saying, I have my DEA X waiver for Suboxone, I think that would also be a great actionable step from today. Yes, sir.
It's interesting. In the last week in Raleigh, there's several signs. You know, they have signs for weight loss, sell your house to me, little, they're semi-illegal. Suboxone is on the sign, and I didn't know what it was until just now. So people are advertising that they'll give you a Suboxone if you come to the clinic, I guess. But,
Right.
yeah.
Yeah, more awareness around Suboxone, basically, is the point, in case you couldn't hear it. So I think 2 steps, right? Ex-DEA waivers for Suboxone if you're a PA, nurse practitioner, or a physician, and then get your Narcan kits. All right, cool. So, but my topic is marijuana, which is a related field, as we'll see here in a second. And the blunt truth, do you get my pun there? So let's see here if technology is my friend. You know, I think whenever you're talking about marijuana, it's really, really, really important to know what people's conflicts of interest are, because there are a lot of people making a lot of money off of marijuana, alcohol, tobacco, opioids these days, and so you just need to know where people's real and potential conflicts of interest are. So I'm just trying to be really transparent around that. Denver Health is the safety net hospital where I'm director of psychiatry. Roman Littlefield, that's where I wrote a book for parents whose adolescents are using substances. Everything I would want a parent, coach, adult, teacher to know about substances and teenagers is right there in that book. I'm in the Army Reserve, and then I think my expenses to fly here were being paid for. The Herps, Dr. and Mrs. Herps put me up and have been my chauffeurs, so I think that's my conflicts of interest. Why you shouldn't believe a word I say. Recognize the health effects, describe the health impact of marijuana legalization, and then just some basics around treatment and how we go about working with youth, adults with substance issues. Does that sound like an okay agenda? Any other agenda that people want for my talk?
I have,
Yes, ma'am.
maybe you can address it. I just addressed it with our last speaker. I do palliative care, so I'm
Yes.
treating a lot of pain for people with a declining trajectory. But would you please comment for the group at large that may not do this kind of work, that there is a difference between addiction, dependence, and tolerance?
Right.
And that many of the things, and no one has even addressed this at all in terms of we're all calling everyone an addict,
Right.
which is not true. And if you could just address those briefly so that people know there is a difference, and that if we don't define those differences, then we're doing a great disservice to patients who have true pain.
Right. Yeah, so just the comment really is there's an important distinction between dependence, addiction, and tolerance, basically. And yeah, I mean, let's see here. I'm trying to figure out if that would just, let's just talk about it now, I think. Right, so dependence is when people, if you just stop their atenolol abruptly, they're going to get tachycardic. So they have dependence on atenolol, right? And so kind of similarly, people can have dependence to a lot of different medicines, including analgesics. And that is to be distinguished from addiction, where there is a compulsive use to something, a loss of control over a substance or a behavior. It could be gambling, it could be internet, it could be a substance. There can be a loss of control there. And so that would characterize addiction. And then tolerance, using more and more to have the same effect. And so really, just because someone has dependence doesn't mean they have an addiction. Just because someone has tolerance doesn't mean they have an addiction. Does that kind of get the point there? Yeah. And hopefully that might come up later. Thank you for that. Summary of health effects. So why do we even care about marijuana? But first I wanted to kind of get us into, this is the joy of having kind of a mental health centric conference, right? Hanging out with any other psychiatrists here? Yes, all right. And we have Dr. Horn, any other mental health professionals here? So when you get to hang out with mental health professionals, you get to do this fun stuff here. So I thought we could do, if you guys are willing, you get to do the woo-woo medicine stuff. No, but in all seriousness, I do take my addiction psychiatry fellows through this at the beginning of the year, just to kind of get us in the right spirit when we talk about addiction and mental health types of issues. So I was going to lead us through a little meditation related to the parable of the Good Samaritan, which has already been mentioned by the good Dr. Horn here. So if you guys don't mind sitting up comfortably, and I usually like to have both my feet on the floor and kind of sitting up straight so my lungs can be nice and open. And I tend to do these with eyes closed, otherwise my ADD kind of kicks in and I get too distracted. So I invite you to close your eyes and just take a few deep breaths. And just imagine that you're a baby taking your first breaths, and you're just discovering what it's like to breathe and what air is like for the first time. And I invite you to wiggle your toes and feel your feet in your shoes and on the floor. And just scan up your body through your calves, legs, and just noticing what's there. No need to change what's there. Noticing any tension, relaxation, comfort, discomfort, whatever's there, it's okay to take it. Up through your stomach, chest, arms, shoulders, face, to your scalp and the crown of your head. And I invite you to picture yourself in the story I'm going to read here from Luke chapter 10, the parable of the Good Samaritan. You may be the Someone in the story or someone observing the story or both at the same time? Just then a religion scholar stood up with a question to test Jesus. Teacher, what do I need to do to get eternal life? He answered, what's written in God's law? How do you interpret it? He said that you love the Lord your God with all your passion and prayer and muscle and intelligence, and that you love your neighbor as well as you do yourself. Good answer, said Jesus. Do it and you'll live. Looking for a loophole, Jesus asked, and just how would you define neighbor? Jesus answered by telling a story. There was once a man traveling from Jerusalem to Jericho. On the way, he was attacked by robbers. They took his clothes, beat him up, and went off, leaving him half dead. Luckily, a priest was on his way down the same road. But when he saw him, he angled across to the other side. Then a Levite religious man showed up. He also avoided the injured man. A Samaritan traveling the road came on him. When he saw the man's condition, his heart went out to him. He gave him first aid, disinfecting and bandaging his wounds. Then he lifted it onto his donkey, led him to an inn, and made him comfortable. In the morning, he took out 2 silver coins and gave them to the innkeeper, saying, take good care of him. If it costs any more, put it on my bill. I'll pay you on my way back. What do you think? Which of these 3 became a neighbor to the man attacked by robbers? The one who treated him kindly, the religion scholar responded. Jesus said, go and do the same. And with your eyes still closed, I invite you to scan your body this time from the crown of your head down to your toes. And simply notice what's there. No need to change anything. If there's tension, relaxation, comfort, discomfort, pain, whatever's there, it's enough to simply notice it. And I invite you to take a couple deep breaths and then we'll all come to. Thank you for doing that with me. Anybody still awake? That really is helpful to get into the right spirit of things. So in terms of motivational interviewing, has anybody here had any formal training in motivational interviewing? Yeah, thank you. So I think if third actionable step potentially for next year, if everybody raises their hand saying, you know, we've had formal training in motivational interviewing, I think that would be really fabulous. If we had our Narcan kits, our DEA waivers, and formal training in motivational interviewing, I think that'd be great. So now that we're in the right spirit, we're going through some of the medical uses here. And so there's been a lot of talk already about CBD, cannabidiol. There are about 70 cannabinoids in marijuana. And a cannabinoid is a 21 carbon-containing molecule, of which tetrahydrocannabinol, that's what gets you high, and cannabidiol are 2 of those. And so a lot of talk about CBD, and so cannabidiol has been shown compared to placebo to be helpful for a certain kind of seizure disorder, Dravet syndrome, and main side effect being GI-related side effects. Has anybody here prescribed Epidiolex? It's now FDA approved, and it's a pure CBD syrup that's available like legitimately through Walgreens or what are the pharmacies here? Eckerd's? I forget. It's been a while since I lived in North Carolina. So talking about CBD, I did want to mention there's a lot of CBD being sold in random places, and most of my patients who think that they're smoking or taking CBD are testing positive for THC. They're still testing positive for marijuana. It's very, very difficult to get pure CBD. Most of the CBD is not pure there. It still has some of the other cannabinoids, including THC in it. In vitro, cannabidiol can be broken down metabolized into THC. In vivo, it's not been shown to do that. So we don't know. It's probably the impurities that are causing people to test positive for marijuana. Pure CBD does not bind to the CB1 receptor in the brain. It does not get people high. It's not supposed to. And this is from the National Academy of Sciences is my source there. It's available online in terms of an exhaustive review for this. You know, there's substantial evidence that marijuana, we have high hopes that it could treat some chronic pain in adults, that it could be an antiemetic for chemotherapy-induced nausea. So in fact, we already have nabilone and dronabinol. So dronabinol is synthetic THC, and nabilone is a not THC, but it binds to the CB1 receptor, the cannabinoid 1 receptor, and those have been FDA approved for nausea related to chemotherapy for a long time. And then multiple sclerosis spasticity, there's a medicine that's in phase 3 trials in the US called Sativex. That's an oral spray of THC. It's available in Canada, parts of Europe. And so stay tuned with that. That's in phase 3 trials here. So there's hope there. Moderate evidence that maybe some cannabinoids, some marijuana might help with sleep for people with chronic pain. So thank you to your point, though. People develop tolerance to the substance. So it's probably not a long-term solution for people. Might be helpful for sleep in people with obstructive sleep apnea, fibromyalgia, MS again. Limited evidence. Limited evidence that it's, so these are like preclinical studies. So maybe we should study CBD for anxiety. PTSD, you know, there's some hope that nabilone, it's already FDA approved for nausea, might help with sleep for people with PTSD. But in terms of crude marijuana, people with PTSD who use marijuana have worse outcomes, more violent outcomes, aggression, and suicide. So I would not recommend crude marijuana for PTSD. You know, it needs to be studied for traumatic brain injury, Tourette's. Probably not helpful, not worth it to continue studying marijuana as a treatment for dementia, glaucoma, depression. Glaucoma is interesting. It can reduce intraocular pressure, but tolerance develops very quickly. So, we have some ophthalmologists here. Anything more to say about that?
You use it almost all day, so 15 plus hours to have any effect.
Yeah, so kind of a short half-life as well for its effect. Tolerance develops pretty quickly, so.
There's no ophthalmologist we know or any from the planet would ever use it.
Right. He says no ophthalmologist reputable who would use it, right. Recommend it regularly. So, insufficient or no evidence. You know, there's talk that marijuana is going to be the cure for our opioid epidemic. Probably not. There are some phase 2 trials of CBD for schizophrenia. Stay tuned. Those are being conducted at Yale. Can CBD directly cure cancer, epilepsy, Huntington's chorea, irritable bowel? if anybody says yes, they're talking way beyond the evidence right now. Okay.
Marijuana did get a lot of popular press in the TV shows in the past year as a cure for
Right.
addiction problems.
So marijuana's gotten a lot of popular press for a cure for addiction problems. In fact,
Talk shows.
yeah, our data, I didn't bring it today, but our youth who use marijuana more likely to use tobacco, vice versa. In our opioid treatment programs, people who use marijuana more likely to have worse opioid outcomes. So I think, yeah, we're just not there yet. You know, I like to start with the good news. That was the good news, right? Why marijuana might be a really cool thing to study more. I was going to go through some of the health effects here. And again, some more good news. And I'm a child psychiatrist, so I'm thinking developmentally. Starting with, that's a woman who's pregnant right there, okay? And going forward, does not look like marijuana use is associated with fetal distress or maternal diabetes or birth length, head circumference, or sudden infant death. So that's the good news, okay? Pertinent positive, so right in medicine a positive is a negative, right? And a negative is a positive. So this is the bad news. So children exposed to marijuana in utero have lower birth weight. The question mark there, is it clinically significant? We don't know yet. Stay tuned. We need more data. Children exposed to marijuana in utero. So this is 1 joint per day during first trimester, yes or no. Those exposed have lower IQ at age 5 by 6 points. They have more depression, more likely to have depression, about twice as likely to have depression at age 10. More likely to use marijuana themselves as 14-year-olds, so that's very unfortunate. So they probably take a neurological hit in utero, and then they're more likely to take another hit in adolescence. This finding here, more likely to use as a 14-year-old, is independent of parental use at that time. So probably has something to do with the in utero exposure. And then those things mediate or cause decreased school achievement at age 14. So it looks like, to sum it up here, in case you zoned out, come back, to summarize, probably not significantly affects physical things, but emotional, cognitive things get affected with in utero exposure. And just as we say no known safe amount of alcohol in pregnancy, there's no known safe amount of marijuana use in pregnancy. Hopefully that's low-hanging fruit. We can disseminate that information and people can agree on that. Having said that, in Colorado, what percent of bud tenders recommended marijuana for first trimester nausea? 70% recommended marijuana in a recent study, 2018. 70% recommended marijuana for first trimester nausea without consulting your healthcare provider.
Wow.
So that's a real opportunity.